Welcome to our podcast series, Identity Dialoguing with the Other and Myself. I'd like to welcome Dr. Juan Román Mora, Nicaraguan physician, healthcare advocate for the LGBTQI plus community. Welcome, Juan, to our podcast.
Hi, thank you. How are you, Anita? Thank you for having me here.
You're welcome. I just want to jump right into the subject of your interesting intersections of identity as a Latinx physician, an LGBTQI plus healthcare advocate, an immigrant. And I was wondering a little bit about how these various identities have evolved over time and how you see your different identity descriptors that might be larger than that and maybe relate to the listeners about this process and journey.
Yes, sure. First, I think I'd introduce myself. I'm Juan Román Mora, and as you said, a physician, I'm a healthcare advocate, I'm a migrant, I'm a Latino. I am a student. I have a lot of descriptors, if we call them in this way, and well, it's actually an intersection of all these descriptors. I was born in Nicaragua. I was born in a small town, in a small city, in a regular middle class family, uh, and I have moved from places. I have lived in very different cities within Nicaragua, and I have moved countries as well because of a lot of reasons. And I think that that has been part of how I have shaped my identity as well. It has been from not being able to connect with people at a deeper level because I was moving from one city to another and not knowing like to what extent I could really integrate with people in the very beginning. I think that gave me a broad sense of really understanding that people um, might be here for a moment and take advantage of this moment and get to know as much as I can of people at the moment. And then if I go somewhere else, it's not like these people are coming with me. I am going somewhere else. And this also gives me a sense of, or at least, and at some point, I developed a sense of not belonging. Uh, and I think that that goes a lot with this descriptor, this identity descriptor of migrant that I have. Also, after all of these movings and migrating from one place to another, once I settled in like for longer periods of time in a place, I got surrounded by people that was very into social justice and or volunteering. And I think that that along with the fact that my parents taught me really well to stand for what I believe, to stand for what I think is correct, and doing it by example. I think that I really got this sense of social justice, and I need to do things. I need to do better. And me seeing my parents doing, I don't know, like giving themselves, devoting their lives for to have like my brothers, my siblings, and me with the best quality of life that we could have, because that's what they know or they thought that they had to do. So they were standing for that. And as an example, I saw that as an example, and I learned that. And then I surrounded myself with people, as I said, and that was really into uh, making the world a better place. And I do remember that when I was in I think it was university, like the very first years of university, there was an earthquake in Haiti, and there were a lot of things going on in Haiti, and I was in Nicaragua. And what is it to do from Nicaragua to Haiti, like the third world poorest country to the world's poorest country? What can I give? And I saw a bunch of people trying to help to do things, and working through and managing, and I wanted to do that. So I got involved and I made friends with these people. And this is part of also who I have become, someone that is aware of realities of other people, of realities that I can help even if I'm not there, even if I'm not living it. There are things that I can do from my place, from my square meter. And well, there are a lot of other descriptors, like I'm a physician, I studied medicine. But then the question is, well, I think that that's a real question. What does, like, I'm a good physician because I say that I'm a good physician, but am I a good physician because I studied medicine, or am I a good physician because I have seen through the years uh, all the gaps that there are in the health system, because I have been a patient before? So is my descriptor in this case the patient or the physician? Am I a good physician, or am I a good LGBTQI plus healthcare advocate because I studied medicine and specialized in this, or because I am also part of the LGBTIQ plus community and have been part of the system on the other end. So I think that that's a really good way to put how intersections work in the case of identity descriptors, and how I have evolved throughout time.
Very interesting. You mentioned a story of addressing an LGBTQI plus situation of somebody transitioning, and I wondered if you could kind of tell the listeners a little bit about this story and how it made you face with your identity and your ethical dilemmas as a physician.
Yes, I do remember that we talked about that. But before we go into that story, I was also thinking about when I was in med school, and we had like these shifts in the hospital. I remember that most of the superiors, like the residents, or the already the I don't remember the word in English, but the already specialized doctors, uh, the specialists, they would um, make jokes about someone that was uh, clearly not cisgender, or not uh, part of hetero patriarchal system. And I remember seeing that, and even I wasn't comfortable in my skin at the moment. I wasn't really aware of my identity. I hadn't had the time or the chance to recognize myself and to accept everything that I am. And at the moment, what I really felt is that there was a system that actually made jokes about this part of the identity. And one of the thoughts that I had by then was, when I am in the position of providing care, I will try not to be this person. I will try to be a person that does not make joke. I will try to be a person that can approach in a compassionate way uh, to all the people. Because if people are coming here to the hospital or to seek for care, is because they are in need, not because uh, they want to bother anyone, or they want anyone to make jokes about them. So I think that was one of the first um, contacts with this reality of, and this convergence between the identity and the LGBTIQ plus community that I had. Then already as a practitioner, I remember that I had a couple of experiences. For example, the transitioning kid. Well, I was already out of the hospital. I was first working in a third level hospital, and then I was running a private practice. So I was already running my private practice, and I have an Instagram page, and this user just approached me, direct messaged me and said, like, I need help because my cousin is going through transitioning and has no support from their family, like from the entirety of their family, like their mom, their dad, and has already attempted suicide a couple of times, and it's been tough. And we wanted to know if there's a way that you could see them and see how, like, how you could help, maybe in the transitioning or in anything. And by the time I didn't have the resources, but I agreed to see the patient, I didn't ask further questions at the moment. I arrived to the place because I used to do in-home primary healthcare, and there were two kids. It was two kids, two 12-year-old kids, uh, the patient and the cousin, and it wasn't ethical for me to actually provide a care. So what I did was just and listening to their concerns and trying to guide them to a better professional, to someone that was actually in the position of helping them. And what I really thought by that time is these uh, people that need trans care, in this case, are being failed by the system. There's a system that is not caring about these people, and these people is suffering. And it's not just these people that are suffering, it's their families. This is uh, a burden not just for the family, it's also for the society, it's also for productivity. It's a burden that is not being taken care of because trans people are being dismissed.
And their
uh,
identities are being dismissed.
their identities and all the needs and the personalized care and humanized care is being disregarded. And I think that is like something that moved me at the moment of understanding how the system is failing not just one person, because this was one case that I saw, that I got in touch. I got another case of someone, of a man that had sex with men and HPV infection, and a lot of stigma and a lot of discrimination at the social security health facilities. And it's the system failing again and again. And this is one of the things that made me realize there's something that I have to do, there's something that I can do. And this is also intersecting with who I am.
So it's actually very interesting what you said about the failure in the healthcare system, your role, who you are, and how you identify it with it. And I'm wondering, just from a public health perspective, do you think by not recognizing these different identities, the healthcare system doesn't put resources to particular diseases or treatments that are needed for particular things that manifest or conditions that manifest in these communities? Do you think that's the case?
Yes, I do think that is the case. I think that not recognizing it's just making things invisible and making, and well, in this case it's not things, it's making people invisible and making them as not valid, making us not valid. So it's as if my problems were not enough problems to be taken care of, as if LGBTIQ plus populations don't deserve the care. And for example, let's talk about fertility care. Uh, Trans populations also get the right to fertility care, legal gender recognition, even having the right to have your name written on your official documents. It's or an enabler or a barrier for you to receive care. Here in the European Union, I'm in the Netherlands at the moment. Here in the European Union, if a country has legal gender recognition acknowledged in their regulations, but another one doesn't, and there is a single market and freedom of movement here, this is an issue that is making a barrier to people. It's not that I am allowed to move to another place because there's freedom of movement, but I'm not going to be recognized there. So I think it covers not just health itself and healthcare, but everything that has to do with the social determinants of health, the housing, the living, the opportunity to have a job, the opportunity to have education even.
Right. Well, I think that's really interesting because you also mentioned something to me in past conversations about how you present yourself and the heteronormative male expectation in the healthcare setting. And I wondered if you could share with listeners a bit of your experience around that.
Yes. Uh, I am someone that, well, at the moment, I wouldn't I would say that I am like in the gender spectrum, like somewhere in the middle of the gender queer spectrum. I do paint my nails. I have my long hair. I have piercings, and I do portray this. Like I do present like this to the world. But I didn't have this opportunity back in the practice where I was at the moment in Nicaragua when I was, because I practiced there for some years as a GP, and I I was living in a system, and I was part of a system that taught you to be, if you are a male person, you have to look this way. You have to have your hair cut short. And I remember that once one of my bosses in the hospital, he yelled at me because I had my hair long, and he yelled at me because of it. And then I remember, well, I have that privilege, but I remember that the next day I quit because uh, that was already something that was trespassing the boundaries of my identity, the boundaries of who I am. And that has nothing to do with what I know, with how I treat patients, with uh, the way that I behave in the institution. I am morally and ethically correct in the institution. So there is no way that I can get yelled at because of my long hair. Uh, and I think that that's one of the things. I got the privilege that I had the support from my family at the moment, and they said, "Okay, if you want to quit because this and this and this, then we support you, and we're gonna be here for you." But it wasn't. Not everyone has this opportunity and this privilege, and it's really tough because also besides that, for example, I do paint my nails, and I like painting my nails. And I remember even, I mean, my dad was in the army, like he was in the Navy, and for a really old man that was in the army in the Navy for 30 years, it was very difficult to understand why his male son was painting his nails, which is something that only female people do. And explaining to him that it has nothing to do with anyone else but me. This is my identity. This is how I portray. This is what makes me feel comfortable. This is what makes me feel my own skin. And knowing him and knowing that he would say to me like, people are not going to treat you seriously because of that. People are not going to take you into account. You don't look professional. You don't, and many other things. And at the moment, for example, I'm studying, but I'm also working here in the Netherlands. So I'm the program ambassador for my program here in Maastricht University. And there's a banner with my picture and long hair and white nails all over the university. And it's just acknowledging that you have to embrace yourself. I present myself with this capacity to embrace my own personality, my own identity, and being able to feel comfortable in my skin is what makes me feel capable of projecting that to the world and being comfortable in front of people and doing my job and doing my profession and studying about what I really care and not what I was taught that was the correct or the good thing to study. Because back in med school, I was not taught to study LGBTIQ plus specific health issues, for example, and we had little to none education on that. And it's not something that I don't have to learn. We all have to learn it. We all live in this world that has a lot of communities, a lot of populations. It's very diverse, and I think that knowing that as diverse as the population gets, that's as diverse as we should have knowledge and care and compassion towards.
Okay, thank you. I was wondering, one of the things that you did mention was by actually expressing yourself and going from public to private practice, you were actually able to reach out to a community that felt comfortable with you in the way you presented yourself. I wondered if you could just share a little bit about that.
Yes. As I said, when I was working at the hospital, I would have to follow this strict short hair, no nails painted, no piercings, no anything. And I decided to go for the private practice after this event, as I told you, as I mentioned before. And I was doing a lot of things. Like I was doing social media and stuff. And I was portraying myself like this, like I am, like with long hair, with nails painted. And I would get patient calls, requests to get care, to get in-home primary care. And people knew that I was me, that I was this doctor with long hair, this male doctor with his nails painted, and even getting compliments from the patients on my nails, on whatever. I think that it just like was just feeling confident on my own skin and recognizing that this is just a part of my identity. This is just one of my descriptors, and it doesn't take away the other. The fact that I am somewhere within the queer spectrum doesn't mean that I stop being a physician and a good physician. So I think that that's one of the things that I learned in this process, that all of our identities are intersecting, and people see that, and people actually go and look for someone who not just knows, but also is compassionate, is comprehensive, is understanding, and probably even goes out of the norm.
Okay, thank you. I was also wondering, what was the most or is the most difficult part of working for the community that identifies as LGBTQI plus? What is the most difficult thing for you?
I think that being part of a system, because in the end, even if we want it or we like it or not, we're still part of a system, and there are things in the system that are very structured in a cis heteropatriarchal way, that, for example, blood donation cannot be given if you are a man that has sex with men. And that's very limiting. So I think that not having the right tools, not having the right resources, for me, it feels like a burden, because I feel like I cannot do much, but I, this is something that I am working on, because of course, I can do as much as I can, and I cannot do everything because there's a lot of things to do, and I feel like not having all the resources available, that's the hardest part. Trying to reach out to a lot of people and not being able to, not having the financial means to support initiatives, not having a support system within, let's say, the government or within the healthcare system or the public health system. Because, and also another thing in practice in clinical medicine is that we have a lot of our diagnosis and everything based on assumptions and based on preconceptions. um, we we just tend to say, let's say, for example, monkeypox, it's only a men that have sex with men disease, infectious disease, and it's just a disease. It's an infectious disease that happens with physical touch. It can be any physical touch. So, but we have a lot of preconceptions and a lot of assumptions, and getting that out of the equation, I think it's very hard in the clinical settings.
So there's stigma and preconception of behavior and the relationship to certain populations, and for example, with HIV or other types of diseases, infectious diseases, or other
Yeah,
types.
exactly. And another thing is, for example, research has been especially done for medicalization. Like the only research done on, or most of it in LGBTIQ plus population, is on diseases, and not precisely on looking for the well-being, not precisely looking for a good quality of life. And I think that's very important. Actually, I read an article a couple of months ago on sex and gender conversion therapy, sex and gender orientation conversion therapy, and the economic burden that is to the US, because it was run in the US. It was like, it's a $9 billion burden in the US for providing conversion therapy, something that should be banned. And it's unbelievable
And
knowing
really,
that no research is done.
right, and it's something that really crushes the identity of somebody. It's really
Exactly.
and it's not, and yeah.
And it causes a lot of insecurities, depression, anxiety, lower quality of life, suicide attempts, deaths by suicide. So it's really taking a toll on mortality rates. It's taking a toll on behaviors, on jobs and housing, mental health, and every social determinant.
Yeah. Okay, that's really a comprehensive answer. Now I'd like to turn to another identity descriptor that you use is a migrant, the one of the migrant, a migrant doctor, a migrant student. And I wondered if you could maybe tell me a little bit about that experience and yeah, and what you've done actually in the immigrant communities you've worked in as well.
Yes. Well, as a physician, for example, I started working in the US in a medical center. That's the main audience or target of this medical center is Hispanic population. It's immigrants that are there on an irregular manner. And knowing that there are specific issues or health concerns in this population is what helps the physician. In this case, it's what helps me to understand certain behaviors or certain habits or customs that people have. And in this way, I can provide an advice. I can provide, because I do a radio program every Monday, and I talk on health promotion, disease prevention, but I have to take into account all the factors that this population is exposed to. And this includes, for example, a lot of these people work in roofing. So there are a lot of sun exposure, dehydration, skin cancer, wear sunscreen. A lot of these matters, of these issues, are not precisely um, are not precisely exposed to other communities, other Hispanic communities, but that are not irregular in the country under migration status. They probably have a different job that does not have this exposure to the sun, to the dehydration, and acknowledging that these people have different opportunities. These people have uh, different backgrounds, have different ways to treat. For example, it's usually the men, because it's a very sexist community at the moment. So it's usually the men that does a lot of hard work. Women usually tend to do um, house chores and housekeeping and stuff like that. So everyone has different types of exposure. And I think the understanding, because I have been a migrant and I have also done a lot of things when I'm in migration status that allows me to do things and not to do other things. And knowing this and being on both ends, I think it just broadens the scope of your approach
So
in
I
this
think what you're
case.
saying is your identity as a documented or irregular migrant, and one is a regular migrant, exposes you to different occupational hazards and different work situations, therefore different health outcomes. And your experience of being both a regular migrant and an irregular migrant has exposed you to these different things so that you can relate as a physician to what types of health outcomes or what kinds of needs there are from a health perspective, and also culturally to understand what those needs are.
Exactly, and also culturally, and that's very important that you say that you talk about this, because I think that cultural competency is one of the things that we are lacking the most in the medical field. I think that we don't really acknowledge, and even in the migration, when you migrate, it's not that you are migrating to a new place and that's it. It's you're migrating to a new place, and this place has a culture, and this can be a shock for you. And the fact that you are here is also a shock for the people that was here already established, and you have to adapt. So I think that uh, understanding this cultural differences and being able to be extremely, or have programs that are extremely ethical on cultural competency, and knowing that the workforce is not only just I'm bringing the workforce because they work better, or I pay less for this workforce. No, it's understanding the culture behind every person. Like every individual has their own culture.
Identity, their own cultural
Yeah,
identity.
yeah, their own cultural identity, and where they come from and what they do, and what for them is to, for example, have a tea, or have a break at 11 a.m. Uh, so there are a lot of these cultural competencies that I think that are lacking in the medical or in the healthcare field, that need to be fulfilled. These gaps.
So I'm actually kind of interested also in how your identity has changed from this move from Nicaragua to the US to Spain and the Netherlands, how the ebb and flows of your pressures to leave Nicaragua, your status in the States, and then your status changing in Europe, how this has influenced your sense of identity over time.
I think that it has just broadened more my descriptors, and with broadening my descriptors, I think it just has enriched me with experience, with knowledge, with expertise in certain fields that I think that it has helped me shape to be a more comprehensive human being, and to also acknowledge that the only thing that we have certain is change, and the person that I was yesterday, I am not today. And knowing that my identity might change because of, or the descriptors of my identity might change because of my context, is also very important. When I migrated from Nicaragua, for example, um, I was in Spanish, it was a vandalico, it was a rebel, because I was against the government in my country, and it's a dictatorship. And okay, do I identify as a rebel? And what does a rebel do? How does a rebel look like? Does a rebel has to look this way or the other way? And I think that evolving and broadening my understanding on my identity and embracing every part of my identity has led me to grow immensely and actually have a more directed project of life towards what I want to achieve, what I want to become in the future. And does this align with the values that I have? Like, are these values the same values that I have from like 5 years ago? And are these aligned with me being fulfilled and feeling that I am achieving this goal? Do I feel satisfied with what I have achieved? And um, all of these learnings that I have had, for example, I was a caterer in the US, and this learning, does that take away the other learning that I have? Like, being a caterer in the US does not take away the fact that I am a physician. Being a student at the moment does not take the fact that I am also a GP. Uh, and I think that understanding that just has led me to grow exponentially and be able to connect with people, and um, to really transfer this experience that I feel that I have, and to bring these insights to broader conversations, and to actually do research for me. Like, at the moment, I am doing a research on how to include LGBTIQ plus populations in policy making in the European Union. And I think that this is just one of the things that I am going to do. But there are a lot of other things. There are a lot of other intersections in intersecting descriptors that I am very interested as well, and that I know that there's a place that I can put my work and put all of this knowledge and all of this experience that I have, and put it to the greater good, to do better and to make the world a better place, if that's what we all here to do.
Great, thank you. So just my final question is if you have recommendations for your peers about navigating complex identities, and what you would recommend to your colleagues.
Okay. Um, I find this question a bit difficult to answer, because I think there are a lot of things that one can do, but it requires a lot of tools, and not everyone has the appropriate tools. But at least I would say that first, it's listen to yourselves. Like, listen, allow yourself to listen to your heart, to your soul, to your mind. What is telling you? Are you comfortable doing what you're doing? What makes, if you're not comfortable, what is making you uncomfortable, and why? Acknowledging that and being able to recognize that maybe what we're doing is not what we want to do, is what we were told that we needed to do. And I think that really understanding that, and there are people that do spiritual retreats, there are people that do mindfulness, there are people that do meditation. In my case, I went to therapy, and me with my therapist, we redesigned my project of life because I wasn't feeling comfortable. And the fact that being able to feel vulnerable and understanding that I am uncomfortable and I needed help at the moment. I needed help because I was stuck, and it's difficult acknowledging that you need help and that you need direction, and sometimes you alone cannot have the direction. Sometimes you need an outsider's perspective. Sometimes you need someone uh, to help you broaden your view on the world and on yourself, and um, understanding that, I think that and being able to do that, I think it's one of the key steps into getting to really embrace these identities and this all of these descriptors that we might have. I think that we need to understand that we have the right to be and the right to exist no matter what. And I think that's very important, because I thought that I had to adapt myself, for example, to a workplace to be able to exist or to be able to be myself. And no, actually, we just have the right to exist just because it is. There is a right. We're here, we're alive, and we have the right to exist. We have the right to be. We have every right to be heard, to be seen, and all of our identities are very valid. And in case you're listening, recognize that your identity is valid, and um, try to understand and deepen your thoughts on this. Recognize every part of you, and recognize that you are not what you do. You are not what people think that you do, what people think that, or what people say that you are. You're much more than that. You're a human being that is learning every day, that is evolving, that is making mistakes, that is improving. And I think that's one of my main recommendation here.
Thank you. That was really, really lovely and a comprehensive answer for recommendations. I want to thank you, Dr. Mora. Dr. Juan Román Mora is a Latinx Nicaraguan physician and healthcare advocate for the LGBTQI community. I really want to thank you for taking this time with us. And I look forward to future conversations and work with you.
Thank you. Thank you for inviting me. I look forward to work with you again. We'll try to see you soon.
Okay.